Get more yes and less BS. Hi, I'm Dr. Avi, and I want to spend a couple minutes today to teach you how to improve your case presentations to lead to more case acceptances. You want to break the dental school habits early. So dental school is a great place to learn the basics of dentistry, get your foundation going, learn the simple do's and don'ts. What I want you to understand is you didn't go to dental school to learn how to talk to patients and get them to accept treatment. You learned the basics of clinical dentistry and how to not harm your patients. In dental school, you learned the science behind cavities, perio, and much more. You learned how to explain, educate, explain, educate, explain, and educate, which is great, but you need to hit the refresh button on that as fast as you can. Reason being, you want to be able to give your patients the highest level of care and get your schedule as full as possible. A tip that I got early on in my career was that patients really don't care about the things that you think they care about. So you got to remember, you were in dental school for 4 years. You were talking every single day to other dental students who were also learning about dentistry. All you do is talk dentistry. People in the real world, they don't do that. They really do not care about the science behind demineralization of enamel or the progression of perio disease as much as your dental school friends did. If they care, they will ask you. You have to remember, they are in your chair to see a professional tooth doctor. That's you. They didn't spend hundreds of thousands of dollars to learn about teeth, diagnose, and treat. You did. So act like it. Confidence is key. I'm not saying don't tell them about anything and assume that they know everything. I'm saying you need to spend less time talking in circles and get to the point. There are many schools of thought on this. People will tell you, oh, educate, educate, educate. Others will say, be direct and don't say anything. I've kind of gone through all of this, and with my experience, I learned that if you are confident in the way that you present something to a patient, they are going to be more willing to trust you. When they need education, I provide it for them. But don't spend so much time educating and educating, because at a certain point, they just want to know what is the problem and how are you going to fix it. A great example of this is something that I learned from Dr. Goodman from Dental Nachos. When you have a tooth that's cracked and it needs a crown, the way that you approach it is like this. Hey, Mr. Smith, you have a crack on your tooth. A crack on a tooth is very similar to a crack on a windshield of a car. At first, it's not really hurting or bothering anybody, but out of nowhere, that crack can become so big that you could lose that windshield. The tooth is the exact same thing. Let's get ahead of this while we are in control and there's no pain, and take care of the issue by putting a crown on the tooth. This will help hold the tooth together and strengthen it so that way we don't have to worry about this crack becoming something worse. That's it. After you say this, you may sense a little bit of hesitation from the patient. If you do, you always end with the following. What questions do you have for me? This clears the air and gives them an opportunity to ask any questions if they're curious. If they don't, great. You're gonna see them on your schedule and you'll be able to take care of them. If you're interested in more courses, you can always text the number below. Text my name, Avi, and they will be able to hook you up with the free course at Dental Nachos. If you enjoyed what you heard today, please drill that like and subscribe button and share it with anyone that you think it may help. Thank you for the time. See you next time.